My first thought was, oh no, not again. I knew nothing about microwave ablation, but it sounded like a much, much better option than open surgery. My name is Susan Piper. I live in Appleton, Wisconsin. My husband and I went to high school here, and after a year of college for each of us, he proposed. We knew right away that we were meant to be, and we had 45 wonderful years of marriage. When I'm home, I love sitting in my sunroom where I read. Most mornings I do silver sneakers. I like to stay busy. In 2001, I started having a lot of dreadful stomach pain, and I started losing weight. I was nauseated all the time. I couldn't eat. I went to the doctor. I went through several different stress tests, and finally they did a CT scan and discovered there was a tumor in the pancreas. It was an extensive surgery, probably 4 or 5 hours, and it was a long recovery time. I had staples up and down the incision area. At the time, they told me the margin was clear and everything looked good. 6 months later, I discovered that it had spread to the liver. After learning that I would have to go through an additional surgery, I was devastated.
Susan did really well until 2011, when on one of her routine follow-up scans, we found a lesion. And in this case, we had several options about how to treat it, and our multidisciplinary group thought that microwave ablation was the best course of action.
So when I met Susan, she was a candidate for an ablation procedure, and she was very anxious coming in because she had just gotten through her very major surgery and the recovery was so hard. Once I was able to explain that ablation is minimally invasive with a minimal recovery, she was put at ease by our conversation, and I feel like felt so much better after we talked. A patient can only have one surgery and then they develop scar tissue. With an ablation procedure, we can do multiple procedures, and patients tolerate multiple procedures well. I have patients that I've seen 3 and 4 times, and Susan is one of these.
When I hear about Susan's case and about how well she's doing, it makes me really happy to hear that she's active and leading a full life with her friends and family.
In the last 6 years, I've had 3 ablations, and the best part of having the ablation is being able to be active again within a week. Back to my classes, back to my routine lifestyle. I would not be fearful of ablation. If that's what your doctor recommends, I'd go for it.